able to get started. I don't think it will be too long on my end, but I hope and welcome questions as we go along or at the end. My name is Janine Lewis. I oversee the Genetic and Rare Diseases Information Center, and I am very happy to be able to talk about this resource today. Now, if I can just advance the screen. Aha, here we go. So the Genetic and Rare Diseases Information Center, which is GARD for short, is funded by two agencies of the NIH, the National Center for Advancing Translational Sciences and the National Human Genome Research Institute. And it was established in 2002 and is part of the Rare Diseases Act of 2002, which includes establishing a centralized clearinghouse for rare and genetic diseases, disease information, provided in understandable language for the public. So we got started in 2002 after that act, and so this is our 15th year. GARD answers questions about rare or genetic diseases in English or Spanish and also other languages as well. NIH has a language access plan that, although it's not really funded, but we will answer, what part of that plan is providing information in people's language as needed. There are two primary channels for providing information. The main one is the GARD website. And on the site, we provide disease information in plain language and resources for more information. And then if people aren't able to find what they are looking for on the website, GARD staff is available to provide support for people who have additional questions that aren't addressed on the site, don't have access to the internet, or just need to talk with someone. And the GARD staff are all trained in genetics. They're all genetic counselors. We also have a medical geneticist on the team. And many people on the team have been with GARD since the very beginning. But most of our staff have been on the team for a long time and have quite a bit of experience in working with families who have rare conditions. And then we have medical consultants through NIH if we need to reach out. So since we started in 2002, we've answered more than 60,000 questions about more than 4,000 diseases. Most of those questions are coming from the United States. 13% are coming from outside of the U.S. And those questions are coming from patients or their family members. And about 10% of people are healthcare providers. And we also get quite a few teachers and students who contact us. Types of questions are probably not a big surprise. Most of the questions that come into GARD are pretty complex. People, have looked in other places, and they, their questions are, in fact, over the years, becoming more and more complex. Primarily, this is the order of frequency of the types of questions that we receive in sort of general categories. But probably most frequently people are looking for information on treatment. How do I find an expert or specialist, someone who's seen patients with this particular condition? Are there research or clinical trials available? There are often people who are undiagnosed, they don't have a diagnosis, and are looking for help in making a diagnosis. Often people have genetic testing results or they would like to have genetic testing and need to know more about how to do that, or who should get tested in the family. Most people have already seen a doctor, but they still have questions about symptoms, cause, inheritance, prognosis, and for a couple, they need more information, but they also want to validate what they've heard. And often people are needing financial assistance, and they're looking for support groups or other families who have a family member with the same condition. And people are, overall often express frustration with it's very hard to find information that's understandable and actionable and in plain language. Even though there is more information out there, it's still pretty hard technical. So the website has been redesigned. So if you've been to GARD in the past, I encourage you to go back and take a look at the redesigned site, where we hope to make information as accessible as possible. The site receives about 450,000 visits every month, and there's a disease page for more than 6,700 diseases. Most of those are rare. And the content on the disease pages is driven by the types of questions that we receive from the public. So each disease page has a disease summary and includes support and advocacy organizations, resource links for more information, and the answers to questions that GARD has received. And there are varying amounts of information on the pages, and it really is driven by what conditions we've received questions about, and that's when we take a look at that page and add content. We have added with the redesign a suggestion update form, where we really want to encourage people to let us know if there's any information that needs to be added, or if there's any organizations they know of that's not there, or if there are any resource links that we need to add, etc. And we have some tools on the disease pages as well. About 200 diseases have something called the GARD Information Navigator tool, and that is an interactive tool that helps people understand how to find frequently asked questions, like how do I find an expert in this condition. And using audio will explain and talk through ways in order to find an expert by going to advocacy organizations, looking at the literature, etc., looking at academic centers. And the disease pages are also glossarized so that the complex terms or the medical terms are defined in a pop-up. So you click on the term and you see a definition, as well as many of them have images to help people understand concepts. And they also have read speaker on pages so that the text can be read aloud. And then the next section that on the site, on the tab, are our guide section. And these are guides that are that we've developed because they are frequently asked questions that span across rare diseases, not just specific diseases. And again, they cover topics that we, kind of fall under our frequently asked questions, like how to find a disease specialist, how to find financial aid, how to get involved in research, and tips for people who don't have a diagnosis. We also have news, that's disease-specific news that we add to the pages as we are aware of the information. And then We have an in Espanol section where we have all of our Spanish diseases. We have more than 200 diseases are now translated into Spanish. And they're really not direct translations. They are, again, based on the questions that we received in Spanish. And our guides are translated into Spanish. So this is the picture of the team who are working on the content and answering questions. Again, although everybody has genetic counseling expertise, we aren't providing genetic counseling. We really are, the goal is to get people to the resources, to a clinician, to a group, to the information that they need in order to kind of get further down the road in understanding their condition. And I can stop here and answer any other questions that people might have so far. And then I have a few other questions that I received that I thought maybe walking through the website might be helpful. So if anybody has any questions at this point.
So this is Michelle, and I have a question. It said that, or you spoke that there were 200 diseases that had already been translated into Spanish. But if there was a specific disease that that someone had a question about that had not been translated, are there representatives that speak Spanish that we could call, or someone that speaks Spanish could call and get that information translated?
Yeah. Okay. So we have bilingual information specialists. They are very happy to answer questions, or from providers who have a patient who needs materials in Spanish, they can provide that information if the disease hasn't already been translated. But I'm just kind of walking through. This is our Spanish section, and you can see the diseases that we have, information in Spanish here. But if there's something that's that people need, you just contact us.
Okay. All right.
Any other questions?
I just tried to unmute everybody on my end, so if you have a question, you should be able to ask.
Well, if not, I thought I would go through the questions that I did receive earlier today, and I think this is kind of a good example of how to find things. By going through these questions, it will serve as a good example of how to kind of navigate through to find information that you might need. The first question is, how can I find out more about the diagnosis? And most people are coming into the GARD website on a disease page, but the examples that I got in the list of questions is propionic acidemia. So I thought I'd use that as an example. And we have, we try to, these are often hard to spell, these terms, so as people are typing a list of disease names, we start to populate. And then you can see, if everybody can see my screen, this is the disease page. And on the disease page, it's all in one page now. So if you were visited GARD before, we had them in separate pages. So now we have them all easy to scroll down. I think it makes it a little bit easier to find the information that you need. But there's a summary, there's signs and symptoms. We pull in the signs and symptoms from, in this chart, from the Human Phenotype Ontology. And so they have translated these terms into plain language. So this year we're hoping to add the plain language term as well as the medical term. And diagnosis, This is a newborn screening disease, so all of the newborn screening support, fact sheets, information about treatment, management guidelines. We also pull in, if you're familiar with OrthoNet, OrthoNet has emergency guidelines for diseases that need them in emergency situations, prognosis, and then these are our action buttons. Again, I highlight those because we really love hearing from people if there's any information that needs to be added or updated. And this is where the organizations that support the disease can be found. And then, of course, if we're missing something or something has changed, we'd love to hear about it. How to get to a genetic service. If you need more information, where to start. This is really easier to understand information. And then where to go if you need more in-depth information. And then this section has the questions that we've been asked about this condition and the answers and references for the page. So in the list of questions, one question was, where do you find treatment options? And I think you can look for that on the page in that section. And then how do I find research projects or programs? And these are populated by clinicaltrials.gov links, but if we know of other opportunities, we will add them as well. And there's a question about, can you search by symptoms? And we don't have a search by symptoms that's just for that purpose. You can use this search bar and type in a symptom, and you will get diseases that have that term in that symptoms table or anywhere on the page. And then from that place, then you can sort what you find by English, Spanish, or by disease category. Chromosome disorders is one where you can see a list of different chromosome disorders that have cleft palate as a symptom. And then organization support that sign and symptom. So you can get information by searching in this main search bar. Another question is, can you search support groups by location? And we do have this feature where you can search groups by country, and that tends to be frequently, more important for folks than what state are these organizations in, mainly because these are rare disease organizations, and if there's an organization, it doesn't really matter where they really are important for anyone with that condition. But we do have a filtered search just for the groups, if that's helpful for people. And then you can search by disease. Before I hit go, I'll show you that for all the groups, you can see all the groups that are in these different countries, if this is helpful. And we wanted to make it easy to find the groups in the countries, just because, for those international inquiries that we receive, it's very hard unless you're local to know what resources are going to be most helpful. And then if you want to search by disease, then you can see the organizations that way. But most people can come into the GARD website on a disease page, and you can find the organizations that support that disease under the organization tab on the disease page. Another thing I think would be helpful to show you is under the guides section, we have guides for these main user groups: patients and families, healthcare professionals, researchers, teachers, and students. And under those guides, you can see our financial aid guide, which is a frequently asked question, and also help with travel costs. We do have a number of resources that address the common questions that we've been receiving in those areas. And then if someone doesn't have a diagnosis yet, we have a guide to help people sort of navigate through the landscape of trying to find a diagnosis, as well as a video to help people think about what they might be able to do next for that. And then at the bottom, I'm a little afraid to touch this thing because I don't want to mute myself, but it's kind of in the way. But you can scroll through all of the guides at the bottom. There's a little scroll button over here, and then you can see all of the different guides that we have available. And this is a work in progress, so we add to these as we have time and to work on them. As questions tend to kind of come up over and over, that's when it kind of triggers, we need to work on a guide for this. I think I answered all the questions that I got, but if I didn't, please let me know if there's anything else that would be helpful to look at together.
I think the one that, I don't remember exactly how it was worded, but one on there about what if you don't have a diagnosis, and I saw the video. It's the one where the boy's in the superhero cape, but it's about the undiagnosed. And I saw the link. It's for the SWAN network, but I wanted to have you address that you don't have to have a diagnosis to receive support. I mean, that's what I was trying to point out, is that there are advocate groups for people who are undiagnosed through the SWAN network. And that's what that video is about. So there's that address for the SWAN network. So.
Right. And I would say about 15% of the people who contact us are in that boat. They have signs, symptoms, and they're on that. They're traveling that odyssey of trying to find a diagnosis.
So this is Michelle talking for just a minute. And my son was undiagnosed for quite a while, and Heartland paid for myself to go to the ACMG meeting as an advocate, and I met Amy, who is the founder of the SWAN network. So she does great work in helping families find support for undiagnosed.
It's also relatively new. Go ahead.
This was Laura. Anyone hear me?
Yes.
Yeah. Okay.
We're one of the undiagnosed too. In fact, we just redid Jeremy's West test, and we just had like one little mutation that came back. So I'm excited to watch this video. I haven't got to watch it yet, but I'm excited to watch that.
Great. Yes, give us feedback too if you have any. We will be redoing these. We've had these up for a while, and it's time to update them. You'll see the older reference to the older site in the videos. The content is still largely what it needs to be, but we'll be updating that in the next year as well. So if there's anything that helps you that that you think might be helpful for others, I'm happy to address it.
Hi, this is Erika from Oklahoma. I have a question. I haven't had time to look at the website, but I was wondering if they have information about financial assistance when your insurance will not pay for those specific genetic testing.
Mm-hmm. I don't know that we have that specific question addressed in here. There are a lot of resources that are included on this page for general medical costs, including genetic testing. But specific to genetic testing, I think sometimes this is something that resources are springing up more and more to help with the cost of genetic testing, especially if it's a condition where the gene is not known. So there are a number of programs that have started to help people with testing and get results back if it's a condition where the gene hasn't been discovered. And so if you look and you can't find what you're looking for on the site, the best thing to do is contact GARD and talk with an information specialist, and they can help you find something that might be useful. Sometimes there are clinical trials where they're looking for genes, and then if there is a clinical test, it can vary depending on what the test is. Labs vary in terms of sliding scale, so it's worth contacting an information specialist to talk about the specific situation.
Right. Thank you. Thank you.
Mm-hmm. Well, this is Michelle again. Are there any other questions for Janine? I didn't see any questions in the chat box. Anna, did you see any questions?
No, I addressed that one previously, but not after the presentation.
Okay.
Well, great. I hope this is helpful, and I encourage you to please give us feedback if you have any. We love to hear from people to just let us know what worked or what didn't work for you. And this is we work on these pages every single day as questions come in. So I encourage you to visit regularly. And then if you can't find what you need, just contact us and let us know.
Okay. Well, I certainly appreciate it because I learned several new things. So, yes, Anna?
Good.
Oh, I was just saying thank you so much to Janine and sending to all of us again, and the patience to get that audio issue resolved.
Sure. No problem. Well, thank you.
Thank you. All right. We'll go ahead and sign off.